Neighbours, Friends and Families is a public education campaign. It is the public education campaign of the Domestic Violence Action Plan of the Ontario government. And so it's our mandate to reach all citizens of Ontario and to teach some really basic skills about recognizing and responding to woman abuse and about being able to make an appropriate referral. So we began with a community-based campaign, working largely through coordinating committees, so providing them with resources which would include training, would include PowerPoint presentations and basic brochures, and allowing them to use their social networks that exist in their community to reach out to people and deliver the information presentations. So we have a standard presentation. Many people took that and added in local contact information, and they used it in whatever context made most sense to them. And then we have our set of 3 basic information brochures, which there have been some very innovative ways of distributing those. So police have distributed them on ride programs. One group stood at the dump on Saturday morning and handed them out as people came in. Community events, fairs, wherever crowds gathered, people have gone and passed out the information. We're working with non-experts, and so I think that what we've been able to do is to respond to the recommendations of the Domestic Violence Death Review Committee, which said that many times in high-risk situations where a woman ends up being seriously injured or killed, a lot of people had information and didn't know what to do with it. And so we're equipping ordinary people with enough knowledge and enough comfort to be able to have a conversation, ask questions, talk about what they've seen that concerns them, and then let the woman know there are places that she can go, there are services that she can turn to. Likewise, if somebody notices a friend or a relative whose behavior is concerning in terms of being abusive, same approach, not to be judgmental, but to express concern and to talk about what they've seen and to say, there are also services in the community where you could go for help. So I think that the impact is really largely has to do with helping to reduce the stigma around talking about this issue and really emphasizing that it's not a private matter, that it's okay to talk about it. We've been able to take that a step forward when we moved a program into the workplace. So we had an opportunity when we had new legislation come through the Occupational Health and Safety Act that requires employers to prevent and respond to domestic violence in the workplace. That opened the door. We've been able to train in over 300 workplaces across the province. So the impact there is, again, we're reducing the stigma because we're talking about it. And you have employers, you have your boss, your supervisor, your coworkers all saying, it's okay to talk about this, more than okay to talk about it. If we notice something's wrong, we have a responsibility to talk about this, to report it. So that I really think all of that helps to address the stigma and bring it out into the open. But more than that, in workplaces, what I'm seeing is that workplaces who really understand the legislation and who are investing in the training, they're sending out a really strong message that if you're experiencing domestic violence, if you're experiencing woman abuse, you're not in trouble. And in fact, if you're having performance issues related to that, you come to us and we'll help you, we'll support you. And that's a real shift. I think people used to be very, very worried about their job, worried about the consequences of admitting anything was wrong. And we're beginning to see that shift and change. The feedback that we've been getting is generally very, very positive. Sometimes when we go in to train. Initially, we get some pushback because we talk about women abuse. And so we've built in at the front end of our training a whole discussion about why we talk about women abuse. So we don't deny that men can be abused as well, but we look at the statistics in terms of who's most likely to experience serious injury, repeated victimization, fear for their lives. And when you look at the statistics in terms of who's most likely to be killed, it's overwhelmingly women and overwhelmingly likely to be male perpetrators. So the statistics help. But in the course of delivering that information, we try to open up some space to have a discussion. And I find where people really start to understand the issue most is when they think about their own lives, they think about their daughters, they think about their friends, they think maybe their sisters or even their mothers. And most people have some personal knowledge of a situation of woman abuse. And so then when they can connect that to what they know happens in their own life, the resistance really eases off a lot. So we've structured our training around really 3 basic skills: recognize, respond, and refer. So we put a lot of emphasis just on recognizing warning signs. And I think that maybe people often had a gut feeling that something was wrong, or they thought that's not quite right. But we've really been socialized to say, not my business, private, too personal, I'll just leave it, I'll just let it be. And so we're helping people to have more confidence when they recognize these warning signs, that it doesn't mean that it's a situation of woman abuse, but it's concerning, and now it's okay to have a conversation. And so the second tenet of our training is responding. And responding is really about being able to have those difficult conversations, knowing that it's okay, knowing that your workplace is encouraging that, and in some cases is even requiring that. So when we have a longer period of time for training, we do a lot of role playing because none of us are comfortable having these conversations. Even those of us who have worked as professionals in this field, it's much easier when somebody comes in and discloses and asks for support. When you're just seeing something and you're wondering, knowing how to approach it is pretty difficult. So we use some scenarios, and we give people a chance to try out a response. And if that didn't work so well, get some feedback, and how could we do that differently? And so I do think that really helps to prepare all of us for when we encounter these situations in real life. And then the final piece of what we're providing is just an introduction to the services that exist, so that we don't have to feel like we're responsible for fixing the situation, or we're responsible for somebody's safety. There are in every community a variety of services and a variety of experts that can help really, whether it's with a safety plan or whether it's with providing shelter, whatever is needed. So we let people know, here's where you go, here's who you can talk to, and they're in your community. You don't have to, go to Toronto to find the expertise. It's right where you live. One of the most important things that we're learning is that if you really want to reach out to a lot of people, and you really want to meet people where they're at, you have to engage them in their communities, through their communities, and through their community leaders, and that there's not going to be one approach, one strategy that's really going to work. So that means that it's been really crucial to have to support the center, to develop resources, to do that thinking about how to put together a training. It's just as important to support people at a community level to be able to implement that. And then it's important for us, I think, to think in terms of learning outcomes and what do we want participants in our training to walk away with. To provide some tools for getting to that point, but not to be too prescriptive in terms of the journey that participants are going to take in each training to get that learning. Because people people start in different places. They have different value systems. They have different worldviews, and so the more that you can allow your core messages to be adapted to whatever context that is someone's everyday reality, I think the more success you're going to have, and people coming away and feeling engaged in what you're saying, and feeling like it actually it makes sense to them. It matches what they understand about the world. We've been working really hard on thinking about sustainability for the project, and because we're now engaged in workplaces, and because workplaces now have an obligation to prevent and respond to women abuse, we see an opportunity to take our training and to use a social enterprise model. We know that workplaces are purchasing training, especially large workplaces, to meet the new requirements of the Occupational Health and Safety Act. And we think that we're working with the real experts on women abuse, and that's expertise that deserves to be recognized. So what we're trying to do is set up training for local coordinating committees and set up a structure so that we can certify trainers, making sure that they have the knowledge base that they need and the skill set that they need to consistently deliver an outcomes-based training. Once we certify them, we are going to allow them to deliver the training on a fee-for-service basis. And so that means that they'll be able to pay the people that will be supporting the program over the long term, and on the long term won't be reliant on government funding. I'm not sure that we'll ever be able to be completely independent. Certainly it will be a process and a journey to get to that point, but I do think that we have a model where we could see needing significantly less money to deliver training to an increasingly large number of people. I think one of my challenges has to do with evaluation. I try to track where the training goes, and I try to track the outcomes. But because we have this really decentralized model, I'm really dependent on community coordinators to get that information back to me. And some of them are absolutely wonderful, and I do get a significant amount of data back. However, there's no reason other than goodwill for them to send their information back to me. I don't fund them to do this work. They're funded through a different funder, so they have reporting requirements there. It can feel really onerous to them to report to their own funder and then to report back to me. And oftentimes people are working in very, very part-time positions to deliver this training. And so if they've got 1 day a week, they're going to prioritize making connections, booking trainings, and delivering trainings. But they're going to, way down on their list of priorities is going to be telling me what they actually did. And so I'm not able to track a lot of what happens. And then I think what that means is that I'm not really able to demonstrate the full reach of the training program, and I'm not able to demonstrate the full impact. So it's, the strength of the program is that it is so adaptable and it is so flexible, and it can be delivered in a really decentralized way. But then it becomes a weakness when I have to demonstrate outcomes and measurements for the project.